I just have the extreme fatigue. I have the occasional headaches and some muscle weakness. I would actually have what I would consider a fairly mild case.
A fairly mild case, but one that won't go away. Wendy Newman has been sick for 71 days now by her count. After a month and a half of waiting for the virus to go away, she got a second test.
It had been a month and a half since the last test, so of course I was going to be negative, and it was positive again. Some days worse than others. This weekend was pretty bad.
Her husband also tested positive for COVID-19 shortly after she did, but he had a very normal case and has long since recovered.
Things like, well, why have I got this? Why is it working like this for me?
Well, it's a great question. We don't have all the easy answers.
Adam Spivak is an infectious disease specialist on the forefront of COVID-19 in Utah. He says while it can't be ruled out, reinfection is very unlikely for patients who have already recovered.
And we think that you do develop an immune response to the infection such that we shouldn't see, at least in the near term, reinfection.
Those that continually have symptoms, and similar to the flu and other infections, COVID-19 can linger and in rare cases cause symptoms to persist.
Use the fever. They tend to get better from that perspective. But cough can persist and fatigue can persist. And unfortunately, these are not uncommon with viral respiratory infections.
And it's that fatigue that has persisted for Wendy Newman.
That's why I've been feeling now for 10 weeks. Well, if I just rest up just a little bit more, I'll be fine. And boom, I am so tired after that. I can't. We just don't know.
Now, Dr. Spivak also told me this is one of the main questions they're working on answering here on the front lines of research in Utah. Spencer Joseph, Fox 13 News, Utah.